Ulrich Schotten, Maastricht University. Digital tools for personalized therapy of cardiac arrhythmia.
Good morning, ladies and gentlemen. This presentation is about atrial fibrillation. Atrial fibrillation is the most common cardiac arrhythmia in adults. More than 6 million people in Europe suffer from atrial fibrillation, and this causes more than 6 billion euros healthcare costs every year. So this is clearly a problem of epidemic scale. Now, during atrial fibrillation, the upper chambers of the heart do not contract regularly as during normal sinus rhythm, but they are activated in a chaotic fashion. And this increases the risk for blood clot formation in the atria, and this can potentially cause strokes. In fact, atrial fibrillation is the most important cause for strokes. Unfortunately, we are not good at treating atrial fibrillation yet. As you can see, even 12 months after initially successful treatment, even with the most sophisticated approaches we have nowadays, 50% of all patients are back in atrial fibrillation. Why is that? That is because atrial fibrillation is a multifactorial disease with ectopic firing of muscle cells in the atria, activated coagulation, connective tissue formation, and also fatty infiltration, all contributing to it. But there is hope. We recently have developed in Maastricht techniques for the visualization of the individual fibrillation pattern, which can serve as kind of a fingerprint for this individual patient and the individual disease mechanisms. And we also have learned how those individual disease mechanisms actually can modify this fibrillation pattern in the atria. We also understood that and how this fibrillation pattern projects onto the surface of the body, where we can record it as a high-resolution ECG, as you can see here. Furthermore, we learned how the individual genetic and blood coagulation mechanisms actually change the individual gene expression, the anatomy, and also the pathology of the heart. We have implemented all this information in four-dimensional computer models, which in turn again show the direct relation between the individual disease mechanisms and the fibrillation pattern in the heart. And all this knowledge was used to develop and validate multimodal prediction models of atrial fibrillation, of the treatment of atrial fibrillation. And those multimodal prediction models are now studied prospectively. We identify individual disease mechanisms using genetic information, the fingerprint of the individual fibrillation pattern, and imaging of the heart. We use this for individual decision making and hopefully in this way improve outcome. Thank you.